Welcome to Presidential Experience Live. Woohoo! Yes, my Prosperos. I am your host, Kanae Quarter, National Certified Counselor and the world's #1 clinical hypnotherapist specializing in financial therapy and stress management. This month, the month of May, we are talking about mental health awareness. And I'm coming to you live, no intro, no outro, no editing, just me kind of spilling out some mental health awareness on you. I'm going to try to go do these live episodes, not every day, but many of the days of this month because there's so much when it comes to mental health. And if you didn't listen to yesterday's episode, go ahead and listen to it and it'll tell you a little bit about what I plan to do and all the topics I want to touch on. And we can't do that in four episodes in 45 minutes because in 45-minute episodes, see, it is live. I'm not even going to edit that out. And because we just can't. It's way too much to talk about. And I know that many of these subjects are important to you guys and we just don't get enough time to talk about them in the real world. And so let's talk about them here because that's what presidential experience is all about. It's all about having the tough conversations. It's all about bringing to light with no judgment what we need to discuss so that we can get to that life of meaning. And our mental health is getting in the way of that. And right now, COVID-19 is getting in the way of us living a life of meaning. So yesterday I asked you, what's causing you the most stress? And for many of you, the answer could be COVID-19, coronavirus. And some of us don't know why it's causing us a lot of stress. Some of us are very specific as to why it's causing us stress. And I want to touch on that today. I want to touch on COVID-19, how it's affecting us, what it caused us to do, and what's the biggest thing you fear. So I don't know what your answer was yesterday. I told you mine. And again, if you didn't listen, go ahead. These are only going to be 10, 15-minute tops episodes. I want to keep them to 10 if I can. And so I don't want to go too far. So wherever we get in 10 minutes is where we go. And then I'll do another episode continuing if we need to the next day. So my first question to you when it comes to COVID-19, because this is sort of like a therapy session. And in therapy, I ask questions and you give answers. And then we guide or, direct a certain way depending on how you answer the question. So what is your biggest fear when it comes to COVID-19? And then my follow-up question to that is, where did that fear come from? Because it's possible that the fear came from external, not internal. Because if the fear is from external, it probably means it's programming. You heard it enough times that you should be afraid, so you became afraid. I want to pose an idea. What if it's not fear that you need in order to survive or even thrive in this COVID-19 crisis? What if it's not fear that's going to protect you? What if it's knowledge? What if it's education? What if it's other words that are going to get you to do the things that will help build your immune system? Because that's what you really, truly need. When you break it all the way down to all the things you could do, wear gloves, wear a mask, stay inside, blah, 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 blah. What it really, really boils down to is having a strong immune system. Is having a strong immune system to not get it, but having a strong enough immune system that if you do get it, you can fight it or beat it. So many of us are afraid because our immune systems aren't strong enough. We haven't been putting enough attention towards our immune system. And let me tell you what's upsetting me mentally, what's got my mental health low. And it's the fast food restaurants are still open, and they are part of the problem. And if you own a fast food restaurant and you're listening to this, I'm not saying that your business is bad. I'm saying that they are not essential. But because we've begun to believe that we can't survive without our burgers and fries, without our fried chicken, without our ready-made tacos, because we believe that now, we're eating things that are harming our immune systems. And I'm not going to tell you, don't eat that ever. Eat it in moderation, not an everyday thing. But maybe the fear that you have is that you won't get back to that life that you had before. Did you like the life you had before? I'm just saying. Because we are also afraid of this new normal or whatever, this new reality that we're about to have to experience. But what if the new reality is like much better than the old reality? Wouldn't that be awesome? But the brain likes familiar, even if the familiar is not a great thing. The brain likes familiar, and it does not like unfamiliar. So it goes towards familiar and away from unfamiliar, even if unfamiliar is better. And we'll talk more about the brain in the not next episode, because I'm going to continue this COVID one more time. I'm going to add a couple things because it's already been 6 minutes, 7 minutes, and I've not gotten as far as I'd like to get. So you're afraid because of external things, because you've been watching the news, you've been getting tweets and lives and all kind of messages telling you about all of the death. But what about all of the life? So if there have been 1,000,000 cases and 50,000 deaths, you do realize that 950,000 people survived. 950,000 people survived. Yet we are focused on the 50,000. And you've heard me say, what you focus on expands. So it could have been a lower number if we hadn't focused on it so much. And the survivors could have been a higher number if that's where we put our focus. And what about the fact that there are 7 billion people on the planet? 1 million is a very, very small number compared to 7 billion. So there's so many of us that didn't get it. I know people are dying. I absolutely know this. I don't have a friend, but my sister has a friend that died of it. So I'm familiar. But what I don't know is what are we going to do next? What are we going to do so this fear does not take us out? And this is not just a healthcare crisis. This is also a financial crisis. And we are overlooking that. So while we're all focusing on the 50,000 deaths, there are things happening in the background financially that aren't getting taken care of. And they're pretending as if they're helping, but some of this they caused. So of course you need to help. If you caused this, of course you need to help. What else would you do? I want you to think about today, what part of COVID-19 is most stressful for you? What part is most stressful for you? And why? Is it external or is it internal? Did you decide that this fear was for you? Or did enough TV tell you that you had to be fearful? And then once you decide if it's external, internal, then decide, is that where you want to put your focus? Or would you like to shift your focus somewhere else? Somewhere that's going to allow for your mental health to improve. This is a choice. You don't have a choice in whether what the news reports, but you do have a choice to watch it. You don't have a choice of what your friends decide to want to talk about, but you do have a choice to decline the conversation. And I heard somebody say it really nicely, and they told me that their friend was texting them bad news, bad news, bad news about COVID-19. And they told their friend, if you're going to be doing research on COVID-19, then I'm going to need you to send me full research. Not just, don't show me just the deaths, but also show me some cases of the lives, the lives, the survivors. So, told you this was live. So then the friend stopped texting them all together because maybe they couldn't find any good surviving stories. It's possible because they're not out there, not many of them. But I do know somebody who came on one of my lives. They told me that they survived it. So people are surviving it. But I thought that was interesting the way they handled it. And I'm about to wrap this up. But I thought that was interesting the way they handled it because they didn't say stop texting me. They just said you're going to have to blend some good in there too. So don't just bring me bad news. All right. So that's our show for today. I want to see you tomorrow. Would you like to hang out with me again? Would you like to talk more about mental health? We're going to continue our COVID-19 conversation. And I want to know what you're going to do next. Send me an email at podcast@presidentiallifestyle.com. That's podcast@presidentiallifestyle.com. You know, the other thing I'd like you to do if you want to, why don't you go ahead and go to presidentiallifestyle.com. Check out our website. Just check it out. See if there's anything there for you. If not, that's okay too. But I don't know if you've been there before. If you haven't, you might as well go now. If you have, you should go anyway because we've made some updates, some changes. Because we used to just focus on one target market, but then after COVID-19, we decided to open up and include the whole family. So go ahead and check it out, and I will see you tomorrow. I'll say same place, but I can't say same time because it's live and I don't know when I'm going to get the chance in my schedule to record it and upload it for you. So I will see you and I look forward to it. Very excited about it. In the meantime, my Prosperos, if you believe it, you will soon see it. I have to tell you that, and I'll tell you why more tomorrow. Have a prosperous day.